Hello viewers, you're welcome to our enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is Dr. Ubong, I'm a consultant neurosurgeon with the University of Uyo Teaching Hospital in Uyo, Akwa Ibom State, Nigeria, and a lecturer with the University of Uyo. In our previous videos, we had considered causes of headache, and we looked at several of them through several videos. And today we are beginning a new series and we are considering the spine. The spine is a very important part of our body, and anatomically it is located between the head and the buttocks. When we talk about the spine, we are looking at the bone that runs from just below our head at the back and extends all the way to just behind the buttocks. And this is what one can describe as the backbone. This backbone has bones, and in between the bones it has disc. Now these are the disc that appears yellowish somewhat, and then the bones are these ones. Those are called vertebrae. This is the front part, which is buried deep into the body, and this is the back part called the spinous processes. Now if you look here, you will notice that there are some structures that are coming out. If you look at it from this side, you would see these structures here mimic the nerves as they come out through the spinal canal to innervate our body. Within this spinal column, we have this yellowish thing you are seeing here, which is the spinal cord. So the main function of the spinal column is to protect the spinal cord, which lies within it. This hole you are seeing here, and the nerves that are coming out through it. And this is the lower part of it, which gets to the tailbone, just close to the buttocks. It continues up to the thorax, to the neck, and then to the just below the skull. Now if we look at this one here, this is the one in the neck, and this is the lower part of the skull, which is connected by this bone to the rest of the spinal column, and then it transmits the spinal cord through that hole and protects it. So we're going to, through several videos, discuss problems that can affect our spine. One of the commonest symptoms in the world is back pain, particularly low back pain, which affects the lower part of the spine, which is this. The lower part of the spine is called the lumbar spine, and this is the sacral spine. So sometimes, and a lot of times indeed, this may cause pain. So today we are going to begin our series on the spine problems by looking at a very common problem that we experience, particularly as one ages. And sometimes you get to the hospital and hear it mentioned and you may be confused about it. So we'll start from there. And that is spondylosis. Sometimes you hear spondylosis and you wonder, what is spondylosis? Well, spondylosis is basically a general term that is used to refer to degenerative, non-specific problems that are age-related and affects the spine. Sometimes it's called arthritis of the spine. But the key thing there is that it is age-related. It is as a result of the fact that as a bone and the structures around it ages, then it becomes more lax, it expands or enlarges, and sometimes may become painful by compressing the structures, particularly nerves around it, and even the spinal cord, as we demonstrated in the earlier anatomy. And when this happens, then it can cause various symptoms which we'll talk about. So in a nutshell, that is what one can describe as spondylosis. If we get back to our bone, the anatomy we looked at, I told us that this is a bone, the vertebrae. These are the bones that are called the vertebrae. In between them, we have the disc. When this yellowish part, which is supposed to be soft and like shock absorbers, when it loses fluid and becomes hardened, then it reduces in height and becomes more stiff, causing the back to be stiff, causing pain. Sometimes it may protrude beyond its confines, the capsule, and extends to compress these nerves that we talked about, these nerves that are exiting. You can see the nerve, can appreciate it better here. This yellowish thing are the nerves. They can be compressed when this disc here bulges out and compresses it. Remember also that the spinal cord lies behind it. So if it protrudes backward, it could compress the spinal cord. And when that happens, all of those manifestations could cause pain. The joint also around it, there are joints there. Just like you have joints in your knees, joints in your elbow, your wrist, there are also joints where we have the spine. So those joints are called facet joints. These are called facet joints. And when they undergo degeneration or arthritis, they can result in pain, which patients will experience as symptoms of low back pain or pain in the neck. So the commonest location of this pain is usually the lower back. The patient will tell you, I have waist pain. I'm sure many people listening to you, many of you listening to me, you have experienced waist pain at one point or the other in your life. It is caused by spondylosis. It may be age-related or caused by other problems, as we will see. And then next to the waist pain is the neck pain. Neck pain could also occur, and we will see that in a bit. So what is the prevalence of, today we'll discuss low back pain. We'll consider neck pain another day. What is the prevalence of low back pain? Remember, we said that spondylosis is age-related. So it means that as one ages, at some point in time, you will experience it. And this age relationship can be predicted. If you look at X-rays of the general population, those that are under 40 years of age, 25% of them would likely have changes on the spine that show that spondylosis is gradually setting in. And those that are above 40 years, almost 50% of them, when X-rays are done or that imaging modality, some findings would show that what we're talking about, spondylosis, is already beginning. And for those who are over 60 years, 65 years of age, nearly 95% of them would have those changes that point to spondylosis. These are age-related changes, degenerative changes. It doesn't necessarily mean that you have a problem. It is only when they begin to cause symptoms. Symptoms like pain, stiffness. Sometimes the pain may radiate into the leg, may cause buttocks pain. Sometimes the pain may radiate into the groin region. Sometimes it may cause weakness in the lower limbs, the leg. It may cause weakness in problems with passing urine, problem with passing stool, erectile dysfunction, numbness in the legs. It is when those more serious conditions occur, then it becomes worrisome. Otherwise, low back pain caused by spondylosis, called lumbar spondylosis, is age-related. And typically, it is commoner in males than females. But of course, it depends on previous activities carried out by this person. We said it is age-related. There may be some genetic predisposition to it. Some families, people tend to have it earlier than other families. People who are chronic cigarette smokers, they tend to also be predisposed to it. Obesity is a risk factor for developing it because of the sheer weight of the body on the joints. This can increase the risk. Sedentary lifestyle, those who have been involved in activities that involved lifting of heavy objects. All of these are conditions that can increase the risk of developing this. Previous trauma to the spine also increases the risk of developing spondylosis. Now, there are other factors that are maybe related to this, but we'll limit ourselves to this few that we've mentioned so far. How is it diagnosed? Diagnosis is mostly based on the clinical manifestation, and the clinical manifestations here would have to be with what the patient reports. So if you notice that you're having waist pain, the waist pain, you take painkillers and it's not going, it persists for weeks, sometimes months, and of course it will be related to the fact that you are aging as well. Sometimes it may be worse in the morning, wake up and you are stiff, feeling stiff all over. Sometimes it may radiate, the pain may get into your thighs, into your legs. Now, of course, when that happens, it begins to be worrisome and one needs to see a doctor. When you see a doctor, x-rays can be done. Those x-rays can help to decide whether it is more serious other than just the fact that they are age-related degenerative changes. More so, other investigations can be done like MRI, CT scans. All of these will be done by a specialist doctor who is proficient in managing spine-related problems. And when this is done, if you have the condition, most patients who have spondylosis will be managed conservatively using physiotherapy, analgesics sometimes, behavioral modifications, weight loss, regular exercises, some other therapies, all of which are non-surgical, can be administered. Most patients will do well with just this, wearing braces, corsets, and all of that. It is only a small percentage of patients who have these spondylosis that become complicated because they have compressed the spinal cord or compressed the nerves that are exiting the spinal cord. And because of that, they require surgical intervention, or the pain is unbearable because the joints are so dysfunctional and are now moving because they are unstable and causing pain related to motion that patients cannot bear. And that's just a percentage of them. Sometimes less than 1% of patients would require this surgery. Of course, the percentage may increase depending on the population. So these patients would benefit from non-surgical procedures. So if you've noticed that you have waist pain, you may be having spondylosis. What should you do? Present to the hospital. You'll be assessed. And if it is not anything serious, you'll be told what to do and the pain should do well. So if you like this video, you can share it. Others may benefit from it. It could be help them manage better their pain. Thank you for listening and look forward to seeing you in the next video.